Hello and welcome to the lecture on Chapter 8. Chapter 8 is the first of two chapters that we'll be talking about orthopedics, or the practice of treating the musculoskeletal system. Musculoskeletal, muscles and bones. Both are considered part of the practice of orthopedics, orthopedics being a word that literally means the knowledge or practice of what makes a child straight. Because that's what bones and muscles do. They help provide structural support. They have other functions as well, but one of their important functions is to provide structural support so that you can stand up straight and support yourself. So Chapter 8 is really all focused on the skeletal system, and Chapter 9 focuses on the muscular system, the muscles. Before I launch into the lecture, I just want to call your attention to this website, www.anatomyarcade.com. It has some games that can help you learn the bones of the skeletal system and the muscles of the muscular system. The two games that I would recommend are this one, Whack a Bone and Poke a Muscle. They're both silly, fun games that actually help you review the names of the major bones and muscles in the body that you'll need to know for the class. Just a suggestion, if you prefer to study through these sort of games as opposed to drilling yourself in the text and falling asleep in your textbook. And this can be really helpful. I'm sure there's also a lot of game apps for smartphones and things. If you I invite you to explore that option as well. But either way, as long as you know them, doesn't matter how you learn them. So my term of the day for this chapter is a little bit of a joke. I picked funny bone as my term of the day, because funny bone is not actually a bone at all. If you hit your elbow in that funny spot and it gives you that weird tingly, paralyzing feeling, it's not actually a bone that you've hit that causes that. It is a nerve. It's the ulnar nerve. It's a nerve that runs alongside the ulna of the lower arm and also along the outside of the elbow. So that is what causes that tingling feeling, the ulnar nerve. So the skeletal system is a system of bones as well as cartilage and ligaments that help to provide structural support for your body. An adult has about 206 bones in their body, which is fewer than a baby has. Babies are actually born with about 100 more bones than adults, and as they grow, the bones fuse together and harden, and so then they have fewer bones, but they are larger. So the skeletal system can be divided into two segments or portions, similar to how the nervous system was divided into the central nervous system and the peripheral nervous system. The skeletal system is divided into the axial skeleton and the appendicular skeleton. The axial skeleton is the skeleton, the bones along the axis of the body. So bones of the head, bones of the spine, and of the chest. The appendicular skeleton is bones of all the limbs and the appendages, as well as the shoulders and the hips. So beginning with the axial skeleton, we have the bones of the head. This includes the bones of the cranium, as well as the bones in the face. So the bones of the cranium, there are 8 of them, even though it may only look like there are 6 listed here. Notice that there are 2 temporal bones and 2 parietal bones, one on the right, one on the left. So in order of my mnemonic here, my mnemonic being F-stope for the bones of the cranium, you have the frontal bone, the parietal bone, frontal, sphenoid, temporal, occipital, parietal, and ethmoid, which I can't point to behind my glasses. The ethmoid bone here in this picture is this pink-colored bone sort of behind the bridge of the nose and back of the eyes. All right, frontal, sphenoid, temporal, occipital, parietal, ethmoid. And you do need to know all of these. as well as the bones of the face, which are the nasal bones, which are in the nose. They help form the turbinates in the nasal passage. The lacrimal bones, lacrimal actually means tears, so the lacrimal bones are where the tear ducts are on the inside of your eye. The zygomatic bones, the bones of your cheekbones. Vomer is the bone in the middle of your nose that forms the septum, the nasal septum, right here. The maxillary bones are the bones of your upper jaw. So there's actually two of them, two bones, maxillary bones, but they're fused together right here, right here. So it almost seems like one, but there's two of them. The palatine bones, which are in the roof of your mouth, and the mandible, which is your lower jaw. Okay. So remember, we said that babies are actually born with with more bones than adults, and as they grow, their bones fuse together. Well, some of the bones that, one example of some bones that fuse together after infancy, when a baby is born, the bones of the cranium are actually not fused together. They are held together by this membranous tissue called fontanelle, which allows the head to be compressed during birth, during labor, so that it can come out of the birth canal. It also allows for room for the brain to grow within the cranium, and then after the brain as the brain completes its growth, the cranial sutures fuse and form these sutures that we talked about briefly in Chapter 2 when we were talking about planes of the body. So you have the coronal suture here between the frontal bone and the two parietal bones. And you have the sagittal plane, or the sagittal suture here along the sagittal plane between the two parietal bones where they fuse. There's also other sutures that we won't talk about back where the occipital bone fuses and the temporal bones fuse, but you don't need to know them for this class. Other bones in the head include the bones of the ears, the ossicles, as they're called. Ossicle is actually a word that means small bone. Osseo for bone. Ical is a suffix that means a small thing. So the ear bones are very, very small. In fact, the smallest bone of the body is the stapes, one of the bones in the ear. Another neat bone that's in the head region, or part of the axial skeleton, is the hyoid bone. It's a horseshoe-shaped bone that's in your neck. It helps to actually control your larynx, your voice box, and it's the only bone in the body that is not connected directly to another bone. So you know that song, the hip bone's connected to the leg bone's connected to the knee bone, and so on and so forth. Every bone in the body is connected to another bone except for the hyoid bone. There's actually muscle tendons that hold it or strap it to other bones, but it is not directly connected. The chest bones are also part of the axial skeleton. So the chest bones include the sternum, which is sort of the central bone, and then all of the ribs that branch off of the sternum. So the sternum here has three parts. So the body of the sternum is this main part here. Then you have the top part, the superior part of the sternum is called the manubrium, and the inferior part of the sternum is called the xiphoid process. Xipho is a combining form that means sword, and oid is a suffix that means resembling. And you can see how this xiphoid process resembles a sharp sword or dagger. There are 12 pairs of ribs that come off that are attached to the sternum, anteriorly attached to the sternum, posteriorly attached to the vertebral column. And I should really rephrase, they're not all attached to both sides. So ribs 1 through 7 are considered what we call the true ribs because they are truly attached to the sternum. Ribs 8 through 10 are called the false ribs because they're not actually themselves attached to the sternum. They sort of fuse with 7 here and then attach the sternum that way. So 1 through 7 are true ribs, 8 through 10 are false ribs, and 11 and 12 back here are called the floating ribs because they are only attached posteriorly to the spinal column and are not attached to the front at all. The spine is the last part of the axial skeleton, also referred to as the backbone or the vertebral column or the spinal column. Lots of different nicknames there. There are 24 individual vertebrae, plus there's the sacrum and the coccyx. The sacrum is also sometimes called your seat bone or your butt bone, and your coccyx is your tailbone. Right? We'll go through. I think the next slide has some pictures. Here we go. So you don't have to know the individual 24 bones of the vertebra, but you do have to know the regions or the regions that the spinal column is divided into. And there are 5 of them. Well, there's 3 regions, and then the sacrum and the coccyx. The cervical region, the thoracic region, the lumbar region, the sacrum, and the coccyx. All right. Cervico means neck. So the cervical region is in the neck. The thoracic region is in your thorax, your chest, through the chest. And then the lumbar region is in your lower back. All right. The sacrum here, the butt bone in your butt, and then coccyx, the tailbone right here. So the bones of the vertebrae have a special sort of structure, and we can identify certain parts of the structure of a typical vertebra. The vertebra within each region of the spine have their own sort of characteristics. So someone like an anthropologist who finds a single vertebral bone can at least tell which region it comes from based on some of the individual characteristics. And we, again, don't talk about that level in this class, but you will in A&P when you take anatomy physiology, assuming that most of you are going to be taking that class. So the parts of the vertebra. Here, this big bony part is the vertebral body, okay? This is the sort of, structurally stiff part that's going to stack up. This hole here is called the foramen. Any hole in bone is a foramen. There are other foramen in other bones in the body, but the main one that we'll talk about, and I don't remember if we mentioned it in the chapter on neurology, but you have the foramen magnum in the back of the cranium, which is where the spinal cord actually enters the cranial cavity. But the foramen in the vertebra is for the spinal cord, also for the spinal cord to pass through. Then you have the processes, the transverse processes and the spinous process, or processes. My husband makes fun of me because I say processes. The transverse processes stick out to the sides, and the spinous process sticks out. Is actually if you sort of bend over and you run your hand up your back, up your spine, those little bumps, those are the spinous processes of your vertebral column. So those are all the parts of the axial skeleton. The appendicular skeleton will start with the bones of the shoulder. It's also going to include bones of the hips, arms, and legs. So starting with the bones of the shoulder, back to this picture here of the chest, but we're talking about the shoulder bones now. So the clavicle, your collarbone, is part of your appendicular skeleton, as is the scapula. The back of your shoulder bone, is the scapula, and the scapula has a couple of parts, so the whole thing is called the scapula. This ridge here ends in this point, and the point on the end is called the acromion. The joint here where the humerus, the bone of the upper arm, fits into the scapula is called the glenoid fossa. And that's really the only parts that you need to know of the scapula. The scapula the acromion, and the glenoid fossa. All right. Bones of the bones of the arms include the humerus of the upper arm and the radius and ulna of the lower arm. I always get the radius and ulna confused every semester. I usually have to double check before I give this lecture which is which, but I have a mnemonic that I've been using that's actually been working pretty well for me. It's really lame and you're probably going to roll your eyes, but my mnemonic is that when you do a thumbs up, like you could say, that's rad, okay? Rad for radius is on the thumb side, right? That's my mnemonic. Roll your eyes. I'm rolling my eyes at myself right now. So radius is on the thumb side, ulna is on the pinky side. And the elbow bone, actually there's a little bone there called the olecranon, which is also a bone in the arm. The bones of the hand are also part of the appendicular skeleton, the wrist and hand and fingers. The bones of the wrist, there's 8 of them. They're called the carpal bones. You do not need to know the individual names of the carpal bones. They're not even mentioned in the text, but they are a group of bones that make up the wrist. In your hands, you have the metacarpals and the phalanges. The bones in your fingers are the phalanges. The bones in your hand are the metacarpal, and the bones in your wrist are the carpals. Okay. We also refer to our in medical terminology, the fingers can also be referred to as digits or rays. Those are both terms that you might come across in reference to fingers. I guess also mentioning the phalanges, all of your fingers have 3 phalangeal bones, except for the thumb, which only has 2. Bones of the hip are part of the appendicular skeleton. You have the ilium, which is the big one, the big crest here. The ischium, which is the seat bones, the sort of I guess, the U-shaped ones, that when you sit down on your butt, or if you sit on somebody's lap and they say, oh, you have a bony butt, they are feeling your ischial bones, right? And then your pubis, which is this sort of the bone here that is at the bottom of the ilium. There's also this pubic symphysis, which is a cartilage pad that sort of holds the 2 bones of the hips together, the 2 hip bones together, and is slightly movable, just ever so slightly movable and expandable during childbirth. So that's everything. Oh, and the other thing to point out here is the acetabulum. The acetabulum is this joint here in the hip bone where or like a socket, where the femur, the large bone of the leg, inserts. So the acetabulum is to the hip, like the glenoid fossa is to the arm, or to the shoulder, I guess, is the proper analogy. All right, so another thing I like to point out, even though you guys are not having a spelling test on this chapter, there will be some spelling questions probably on the tests. So you still are responsible for knowing proper spelling in general, and particularly spelling words that I point out during lecture. The one I'm pointing out now is ilium. That might be should be a familiar word to you, because we saw it earlier when we were talking about the digestive system, the gastrointestinal system. The ilium with an E is part of the small intestine. It's the last part of the small intestine. Ilium with an I is part of the hip. I do like to throw that on tests and try to throw you for a loop. So, and it's also important in terms, if you think about it, if you are a nurse or you are someone in a hospital and you are making a note that, your patient had surgery on their ilium, it kind of makes it, if you spell it wrong, you're talking about a totally different body part. So it is important. Spelling is important, so you know what you're talking about. So my mnemonic here is that the ilium of the intestine, ilium with an E, E for enteric, intestinal. Ilium with an I for hip, hip, because there's an I in hip. All right, those are all the bones of the hips and the arms. Now we're on to the bones of the legs. The large bone in the upper leg is the femur. The bones in the lower leg are the tibia and the fibula. So the tibia is pretty chunky. It's a big bone. That's your shin bone. And if you've ever been kicked in the shins, that was your tibia. The fibula is a much smaller bone compared to the tibia that runs alongside the lateral side of the leg. And the patella is the knee bone here. In parentheses next to all the bones, I have the adjectives referring to the bones. If you're talking about something with the femur, you're talking about, like for arteries, the artery that runs along the femur is the femoral artery. Artery that runs along the tibia is the tibial artery or tibial nerve. Patella, patellar, these are all sort of, I don't know, they make sense. Then you come to the fibula, and for some reason when you're talking about the fibula, the adjective is peroneal or perineal. Though I've been told by other colleagues that now in the field some people, they will say fibular. So both fibular and perineal actually refer to the fibula. There's no perone bone or something. Yeah, so then down in the feet and ankles. So here's the tibia and the fibula, and here's your ankle bones, those bones that stick out on either side of your foot. Let's see if I can get my foot up. Not really. All right, your ankle bones here and the one on the inside. Are actually the ends, the pointy ends of the tibia and the fibula, referred to as the medial malleolus and the lateral malleolus, or malleolus, I think is the actual correct pronunciation, but I've heard both. So malleolus or malleolus is the term for the ankle. Inside ankle being the medial malleolus and the lateral malleolus on the outside. The bones of the feet include the talus, which is, I guess, sort of the ankle bone, where the inside of the ankle, not the outer ankle bones. The calcaneus is the name of the bone of your heel. Your heel bone is the calcaneus. Then you have the tarsal bones, which are kind of like the carpal bones in your wrist. There's the tarsal bones in your feet. Then you have the metatarsals and the phalanges. So it's very similar to your hands, which have carpals, metacarpals, phalanges. Your foot has tarsals, metatarsals, and phalanges. The toes also can be referred to as digits, just like the fingers can. And similar to the hand, each toe contains 3 phalangeal bones, except for the great toe, which only has 2. And the great toe is also referred to in medical terminology as the hallux, Hallux. The hallux is another name for your big toe. So those are all of the bones that you need to know for this class. It's a relatively short list compared to those that you probably need to know for human biology or anatomy physiology, but I think it's a manageable list. The bones are joined together, except for the hyoid, by joints, or also called articulations. And articulation is another word for a joint, and it's just where 2 bones come together. There are 3 types of joints in the body. There are sutures, symphyses, and synovial joints. A suture is an immovable joint, okay? There's no cartilage there, there's no padding or anything. It's just 2 bones fuse together and they don't move. And a good example, I think the only example of sutures in the body are in the cranium. Once the cranial bones fuse, they form sutures that are immovable. A symphysis is a slightly movable joint. There is a cartilage pad there. The one example that I have, do I have a slide on it here? No, I don't. Is the pubic symphysis. I'm going back to that slide for you here. The pubic symphysis is a symphysis joint. There's a cartilage pad there. The hips don't really move, really, ever. The time that the symphysis becomes slightly movable is usually during childbirth when there's something really pushing against it. The last type of joint is a synovial joint, which is a fully movable joint, a joint that's meant to move, and it contains synovial fluid. Now there's actually two types of synovial joints. There are hinge joints, those that sort of move in two directions, so think of your elbow. It moves sort of, you can bend it and you can straighten it, but you can't really rotate around it, okay? Your knee as well. They work like a door hinge. You can open the door, close the door. Ball and socket joints are the other type of joints. That is, think of your shoulder, which you can rotate, and also your hip joint. Those are ball and socket joints. But all synovial joints are filled with a fluid. There's a membrane, a fluid-filled membrane that pads the bones in that joint. So here's two bones in a synovial joint, and here's the synovial membrane in pink, and in blue is the synovial fluid. And this membrane and fluid just help to cushion and sort of lubricate these bones so that when you move the joint, it's smooth. You know, I don't need any WD-40, there's no squeaking, there's no chafing of bones. There's also usually a small cartilage pad there to just enhance the protection of that joint. Ligaments and cartilage are also part of the skeletal system. They're not bone, but they're like bone tissue, or they're related to bone tissue. They are strong, fibrous. Ligaments are strong, fibrous types of tissue that hold bones together, particularly in a synovial joint. Whereas cartilage is a little more flexible type of connective tissue. Some of the basic anatomy physiology of bones. The medical term for bone tissue is osseous tissue. Again, osseo being a combining form for bone. It's a type of connective tissue. In anatomy physiology, you'll learn about all the different tissue types. And bone is a type of connective tissue. The surface of the bone is actually covered with a membrane, like a protective sheath, called the periosteum. Peri, meaning being a prefix that means perimeter or outside of. So the periosteum is the outside of the bone. The bones have, this stereotypical shape. They have this sort of bulbous ends and then a thin shaft in the middle. The ends are called the epiphyses, plural, or an epiphysis, two epiphyses. And then the shaft part is called the diaphysis. So the epiphyses are on the outside, or the ends of the bones, and the diaphysis is the shaft in the middle. And bone growth takes place in the epiphysis in the epiphyseal growth plates. So these plates here, you can see epiphyseal growth plates, which is where bone growth actually takes place during the years where your bones are growing. So the bone tissue, there's also some interesting stuff about bone tissue. On the outside of the bone, the sort of outer layer of the bone, and particularly throughout the diaphysis of the bone, the hard, most sturdy structural part of the bone is the compact or cortical bone. This is like a dense bone tissue. Then in the epiphyses, you have spongy bone, or also referred to as cancellous bone. And this is sort of bone, it's got this scaffolding structure, sort of like the scaffolding of a house, so it actually does reinforce the structure of the bone. It helps, the way the bones are set up this way, to make them strong, but also to make them light, because if the bones were all solid mass, you would be very, very heavy, and that would have its toll. So having this scaffolding structure within the epiphyses helps to make the bones weigh a little bit less, so that we weigh a little bit less. The bones also have two different types of marrow. We talked about yellow marrow and red marrow, and that the blood comes from the red marrow in the bones. And that's all I really wanted to talk about on this slide. All right. Ossification is the medical term for the process of bone formation and bone hardening. So bones are not, they don't just, actually your bones undergo this process of ossification throughout your life, not just through periods of growth. Bones are very dynamic. There's two sets of cells in your bones that are always at work. There's the osteoclasts, which are there chewing up and breaking down old and damaged and dying bone. And then there's the osteoblasts that come in to deposit new bone tissue to replace that the osteoclast just ate up. Now, as you get older, when you're younger, I guess, the osteoblasts are depositing more bone than the osteoclasts are eating up. As you get older, that balance shifts, and as you get much older, the osteoclasts sort of start to out-function the osteoblasts, and so you get more bone degeneration than you do bone replacement. I like this little tidbit from the book. About 10% of the skeleton is actually broken down and rebuilt each year. So right now your skeleton is breaking down and being rebuilt, keeping things fresh. So that's the basic anatomy of the skeletal system. Now for some diseases and conditions of the skeletal system, part 2 of the chapter. Avascular necrosis is just a condition where there is loss of blood supply to the bones and you get death, necrosis. Chondroma, chondro, is a combining form for cartilage. So a chondroma would be a tumor or mass of the cartilage. Chondromalacia patelli is a condition, it literally means a condition of softening of the cartilage of the knee. So this can be a painful condition as the cartilage softens in the knee, it doesn't pad, it doesn't protect the knee as well, and you can get loss of cartilage there. And fracture is actually any type of break of the bone. When I was younger, I fractured my arm, and somebody told me that a fracture is when it doesn't break all the way through, and a break is when it breaks entirely. But it's not really true. A fracture is just the medical term for a broken bone. But there are a lot of different ways that a bone can break or fracture. Here's a picture of a fractured bone. Looks like the fibula in your leg. So the book has a table of a number of different types of bone fractures. So there's closed fractures versus open fractures. A closed fracture is the type of fractures that I've had in my life. The first time I fractured my wrist, or actually I guess it was my arm, I'm not even sure which bone it was, my ulna or my radius, I think. I was roller skating and I fell on my arm and caught myself with my arm, and I think it was just a green stick fracture, which is here. It didn't break all the way through, it just splintered a little. But the point was that the bone was not sticking out of my arm in any way. The skin was still closed, so it was a closed fracture. An open fracture, often referred to as a compound fracture, is the type where the bone breaks and actually pokes through the skin. There's actually, from a very violent accident, I suppose. Fractures can also be described as displaced or non-displaced. A non-displaced fracture is when the bone breaks but is still sort of in the right position, like here. Whereas a displaced fracture, the bone breaks and then the bone pieces sort of separate. So in this slide, I would say this is a non-displaced bone fracture. That if you left the bones like this, they wouldn't be able to heal back together properly because they're not situated on top of each other in the right place. So if you have a displaced fracture, oftentimes it requires surgery. I mean, the doctor might be able to manipulate it without opening you up, but a lot of times it requires surgery in order to put those two displaced bones back together, and oftentimes to maybe screw them together to keep them in place so that they can then heal properly. A Colles fracture, this is an eponym named after a doctor who described it. This is a typical fracture in people who fall forward and catch themselves on their hands and they break the radius, the distal radius of their lower arm. A comminuted fracture is one, it's like a shattering fracture. So I don't know if you got hit by something like a baseball bat and it sort of shattered your bone into some pieces. Then that would be a comminuted fracture. A compression fracture typically occurs in your vertebrae. Like if you fall on, and I had a student one semester who her boyfriend was in a snowmobile accident and fell like over a cliff or something and landed on his butt really hard and had some compression fractures in his vertebra. So from falling really hard on your butt, that pressure causes, the compression of your vertebrae, and they sort of crunch and crumble a little bit. A depressed fracture, this one is namely in the cranium, since it's sort of spherical. Depressed fracture would be where the bone is probably, I guess, like a comminuted fracture because it's bone pieces. Makes me think of an eggshell, like when you hard boil an egg and then you tap it to crack it so you can peel it. It's like that. There's a depression and it's all cracked. A green stick fracture, I mentioned already, when it's not broken all the way through, when a bone is not broken all the way through. A hairline fracture, also not necessarily broken all the way through, and it's a very thin fracture line. These often hurt but don't require any kind of casting. Well, I guess it depends on where the fracture is. You can describe a fracture by the angle of the break. So an oblique fracture, it's broken on an oblique or diagonal angle, whereas a transverse fracture is broken along a straight transverse angle. A spiral fracture occurs when there's a twisting action, if you break a bone from twisting. We're not going to watch this video. It just talks about how osteoblasts and osteoclasts come in and how new bone tissue is formed after a break, how a bone heals. So some other diseases of the bone and cartilage include osteomalacia and osteoporosis. These are two similar diseases, both involve a weakening of the bones. Osteomalacia is a softening of the bones, and it is reversible. Sometimes it's due to nutrient deficiencies, and it can often be reversed through vitamin D and calcium supplementation, but it does make the bones more prone to fracture. Osteoporosis is not thought to be reversible. So this is a picture of normal bone tissue, spongy bone tissue, versus osteoporosis, spongy bone tissue. So in that spongy bone, remember you've got all this webbing, this scaffolding, and in osteoporosis, that scaffolding starts to break down and you get more pores. That's what osteoporosis, a condition of pores in the bones. And you can't build those back, really. So most medications and programs to treat osteoporosis are either preventative or they are to slow down the progression of the disease, but there's not really any that can reverse it. Osteomyelitis is infection of the bone and the bone marrow. Myelo can mean myelin sheath, like myelin, or it can mean bone marrow. It's got a couple of definitions. Some misshapen or conditions of the vertebra include ankylosing spondylitis, which literally means crooked spine, which is a degenerative disease, and I think it's an autoimmune disease. Kyphosis is the medical term for hunchback. My little cartoon here, the Hunchback of Notre Dame. And that is, so hunchback or kyphosis is excessive posterior curvature of the spine. So when the top of the spine has a, so the spine, I want to go back. Where are we? The spine is naturally curved. It's not straight. You know, people say stand up straight. Even when you're standing up straight, your spine is not actually straight. If you look at this picture here, the spine is actually curved. So this, if this part of the if the thoracic spine has an excessive posterior curvature here, that is called kyphosis or hunchback. If there's also a normal curve here in the lumbar spine, but if it's too excessive, and the normal curve is an anterior curve, it curves towards the front. If it curves too much, if you have an excessive anterior curve of the spine, that is called swayback, is the layman's term, and lordosis is the medical term. And I have a sort of an x-ray picture, I think, of that here. Or maybe I don't. Nope, I don't have a picture of it. But you can imagine it. A lot of people with swayback, they look like they're sticking their butt out when they stand up straight. They have just a very excessive curvature of the lower back. Scoliosis is having a crooked spine, when the spine sort of curves sideways. So here's an example here of someone who has pretty moderate to severe, I would say that's actually pretty severe scoliosis. And spondylolisthesis. One more time. Spondylolisthesis is the word for slipped disc, which is there's actually cartilage pads between all of the vertebra. And if one of them gets squished or ruptures, oh no, I take it back. Sorry. Spondylolisthesis is not a slipped disc. That would be a radiculopathy. Spondylolisthesis is actually a slipping of the spine forward, so it might be a little bit hard to see in this picture, but if you can see, here's the sacrum, and the spine should be like this, should be stacked on top of the sacrum like this, but instead the lumbar vertebra are sort of shifted forward. They're shifted forward, they have slipped off the track, off of the sacrum. That's not the same as a slipped disc. This is a slipped spine, spondylolisthesis. Okay. Some diseases of the joints and ligaments. Arthralgia. Arthro is a combining form that means joints. So why do I not? I guess I have arthritis on another slide. Here it is. Arthralgia is any pain in the joint. So this can be from arthritis. You can experience arthralgia as a part of arthritis. Or you could experience joint pain, I don't know, for a number of reasons that I can't think of right now. Arthropathy is a general term for any type of disease affecting the joints. Gout is a condition where you have uric acid crystals build up in your joints. So it can be dietary due to kidney malfunction, not dehydration, other dietary causes of gout lead to this precipitation of uric acid in the body that then ends up in these joint spaces and causes pain in your joints, often in the feet. Hemarthrosis. What does the prefix heme mean, or the combining form heme or hema? Blood, yes. So hemarthrosis would be a condition of blood in the joints. Okay. Here's arthritis. In this case, the term is osteoarthritis. So inflammation of the bone and the joint. Arthritis would just be inflammation of the joint. Rheumatoid arthritis is an autoimmune disease. So the body, for some reason, the immune cells attack joints, tissues, and joint tissues, and cause arthritis of the joints. And here's a picture of rheumatoid arthritis. Arthritis in the fingers can cause chronic inflammation of the joints, can cause malformation or misshapen joints. Those are the main ones I want to go over on this slide. Pectus excavatum is an interesting one. So I actually had a friend who had like a dent in his chest, and we thought it was like a dimple or so, but he might have had mild pectus excavatum. I don't know. He never said. But pectus excavatum is an indentation I think it's in the sternum, and oftentimes there's no pathological consequences of it. It's just, what's the word? Cosmetic. Some people don't like the way that it looks. I think I got this picture off a website of some, teenage boy who was having plastic surgery to fix his pectus excavatum because he didn't like the way that it looked. But I think maybe in some severe cases it can cause congenital deformity of the bony thorax in which the sternum, particularly the xiphoid process, is bent inward, creating a hollow depression. Surgery, if severe, is the treatment. So I think it's normally not, it doesn't endanger your organs. In a lot of cases, it's just a funny looking indentation. Some diseases that affect bones in the feet and legs. Genu valgum and genu varum are conditions where the legs curve either inwardly or outwardly. So knock-kneed are when the bones curve medially, and so your knees knock together. And genu varum, bow-leggedness, is when the bones curve outwardly. I know bow-leggedness can be due to rickets, which is a vitamin D deficiency during childhood. I'm not sure if knock-kneed is similar or if it's just congenital. Hallux valgus is the medical term for a bunion, which is sort of excessive tissue inflammation at the joint where the big toe is. And again, something that oftentimes can be a cosmetic issue, but if it gets really big or really bad or really inflamed, it can be very painful and it can be removed surgically, which would be called a bunionectomy, which is coming up in a couple of slides. And lastly, there's talipes equinovarus, which is the medical term for clubfoot. This is a congenital condition. Sometimes babies are born this way. I don't know if it's due to positioning in utero. Sometimes clubfoot can be fixed just by casting, by repositioning the baby's foot and sticking it in a cast so that as the bones start fusing together, they fuse in the correct orientation and it corrects that. In really severe cases, I think they have to have surgery. Some diagnostic procedures. Those are all the diseases that we'll talk about in Chapter 8. There's a few medical procedures and diagnostic procedures that I wanted to mention. Those are arthrographies. So an arthrography would be a way to measure a joint, to look at the joints to see if they are healthy. Goniometry is a process of measuring angles, and this is a picture here. Did I steal it from your textbook? Yes. And essentially it's used when people have injuries of the joints, and you're looking at the range of motion that they can do. So I had a friend who had a rotator cuff tear, and she could barely lift her arm, and then as it started to heal, she could lift her arm more and more or rotate it more and more. So that was something that they could measure using goniometry as an indicator to assess, the healing process. Arthrocentesis is a surgical procedure where if you have a lot of fluid in a joint from arthritis or something, or some kind of, I don't know, sports injury where there's a lot of inflammation in the joint, they can actually go in, stick a needle in, and pull out some of that fluid to reduce the swelling. So centesis, remember, means to puncture, really to puncture and withdraw fluid. Some other surgical procedures, an arthroscopy. If you have a lot of pain in a joint and doctors can't figure out what's going on, they can go in surgically and examine it and see what is going on. So arthroscopic surgery is oftentimes, they don't cut open your whole arm, but they cut in a couple of holes. One hole is for the camera, one hole is for like a saline hose, and another hole is for the tool that they're actually using, maybe to shave away cartilage or something. Bunionectomy, we mentioned, to remove the surgical removal of a bunion or of a hallux valgus. Some surgical procedures if you break your arm. If it's a closed fracture, that, for instance, in my case, I had that closed green stick fracture. All right, there was no need to go in surgically and fix anything. All they had to do was just immobilize my arm until the bone healed. So I got a cast. Casting is often done for fractures. If you have a compound fracture, an open fracture, oftentimes you need to do some surgery. And in that case, a lot of times with compound fractures, the surgery is called open reduction and internal fixation, or ORIF. So reduction, when we talk about reduction and fixation, reduction means to put the bones back together, and fixation means to fix them in place. So an external fixation would be like a cast, actually. A cast would be an external fixation, or a splint. You're fixing it in place externally. Closed reduction would be, I guess, like if you displaced your elbow or your shoulder. What's it called? A displaced shoulder? Is that what it's called? I'm blanking. Hopefully you know what I'm talking about. And they just pop it back in place without having to do any surgery. The doctor just dislocated shoulder. Okay, if you dislocate your shoulder, they can just pop that back in place. That would be a closed reduction, I think. Open reduction is when, so my example here is one of my friends was in college. She was playing co-ed softball. I think they're co-ed baseball. And somehow, I still don't understand how this happened. She got tackled. I guess she and another guy were running for like a fly ball at the same time, and they collided and fell, and he fell on top of her, and her ankle got twisted under his leg or something. It got twisted, and he fell on top of it. So she shattered her ankle. So she ended up having to have surgery for the doctor to go in there and reposition the bones, and then have screws in there that screwed them together to hold them in place. That was an open reduction and internal fixation. If you lose a limb, you can have a man-made replacement limb called a prosthesis put in place. And losing a limb, having it cut off by a doctor, is amputation. Most people know that one. And that is Chapter 8 for you, what you need to know. I don't, again, of course, the abbreviations you don't need to know, and we're not going to go over the drug categories, though analgesic drugs should be familiar from Chapter 10. So that is Chapter 8. Thanks for watching. Bye.